Hello everyone. Good afternoon. Good afternoon. Good afternoon. How are you guys? How are you guys? How's it going? Good afternoon. Ambadipuri is here. Good afternoon. Jyoti E4Z. Good afternoon. I'm all good. Thank you, Ambadipuri. How are you? How are you guys? Give me a thumbs up. Give me a hi so that we can start with the another question paper that we had in 2023. 2023, yes. So, how's it going? How's it going, guys? Where is the PDF available of these questions? PDFs are not available, Jyoti. PDF are not available. You can absolutely find, Jyoti, you can get the questions over here only. You can take the screenshot as well, right? Okay. Where are you from, Jyoti? Where are you from? Ambadipuri will tell you how to, predict the rank. Will tell you, don't worry. Okay? Chalo. Okay, 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 okay. So, Naiper, very soon, very soon, very soon, very soon. Maybe in a day or two. Maybe in a day or two. Very fine. Very soon. Chalo, guys. So, in this session, we'll be having total 75 questions. Pharmacology 24, Human Anatomy Physiology 2, Pharmaceutics 9, लखनऊ लखनऊ से तो मैं भी हूँ लखनऊ अच्छा लखनऊ से तो मैं भी हूँ चलो very nice. Okay, now this one. Pharmacology, we have 24 questions. Human anatomy, we have 2 questions. Physics, we have 19 questions. Microbiology, we have 5 questions. Biotechnology, 2. Organic, 9. Medicinal, 2. Analysis, 3. And pharmacognosy, 9 as well. Okay, so total we have 75 questions over here. Okay, 75 questions over here. Uh, shall we start, guys? Are we good to go? Are we good to go? लखनऊ में कहाँ से ज्योति? लखनऊ में कहाँ से? लखनऊ से तो मैं भी हूँ वो पे. Okay. चलो, are we good to go, guys? Give me a thumbs up. Are we good to go? Okay, so before good to go, we should take the Alambag. क्या बात है? Nice. चलो, fine. Subject analysis. आज शाम को वैसे आलमबाग जाने वाला हूँ मैं किसी काम से. चलो, no worries then. Now, here you go, the first question, right? And first question we do have the analeptic drug, central depressant of motor function, analgesic drug, as well as the hallucinogenic, right? Roshan. Hello, Vishwajit. Welcome back. Roshan Kohle. Rochna. Rochna Kohle. Okay. No, analeptic drug. Analeptic drug, central depressants of motor function, analgesic drug, or hallucinogenic. So we do have this one, right? Central depressant of motor function. That is obviously going to do with which one? Analeptic is which one? Hello, Vishwajit. Hello, 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 hello. Chalo, guys, tell me this answer. Answer of this question. Answer of this question. Analeptic drug, central depressants of motor function, analgesic drug, and hallucinogenic drug. Hallucinogenic, that is going to be CVS, right? That is going to be for sure. Huh? So here you go. So D is equal to 4. And here you have the first answer. Analeptic is going to be the picrotoxin. B, central depressant, is going to be third, and analgesic is going to be the first. That's right. And C is equal to 1. So C is going to be the correct answer, right? C is going to be the correct answer. Okay. Now, post-marketing surveillance comes under clinical trial. Simple, 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 simple. The human फार्माकोलॉजी एंड सेफ्टी, ह्यूमन फार्माकोलॉजी, फार्मा, अरे यार कुछ दिख रहा है मुझे, हाँ दिख तो रहा है, फार्माकोलॉजी एंड सेफ्टी। सर अभी जस्ट 2025 का पेपर करके आ रहा हूँ। अच्छा, कितने बने क्वेश्चंस, कितने बने क्वेश्चंस एंड हाउ मच मार्क्स यू गॉट? चलो फेज एंड फेज टू, दैट्स अ थेरेप्यूटिक exploratory, right? And phase 3 is going to be your therapeutic confirmation, and phase 4 is your pharmacovigilance, and post marketing surveillance. That's your PMS, right? PMS, right? And if you see this thing, you have to learn what is the synonym of this one. Phase 1 is also known as a human pharmacology safety, means first priority, first प्रायोरिटी ऑफ ह्यूमन इज सेफ्टी। तीसरी बने, कोई बात नहीं, फिर बन जाएंगे, है ना। ह्यूमन फर्स्ट प्रायोरिटी ऑफ ह्यूमन इज सेफ्टी, राइट। थर्ड, थेरेपेटिक कॉन्फर्मेशन and therapeutic exploratory. Okay, so you have similar kind of the keywords over here, exploratory and confirmation. So C comes at third position, right, in alphabetical order. So therapeutic confirmation. Yep. And pharmacovigilance, post-marketing surveillance, everybody knows about this one, right? Right. And the one question which was asked in GPAT this year, that the maximum tolerable dose, MTD, as well as the safety. MTD, गर्ल आकांक्षा, हाय, क्या बात है भाई, हाय हाय कर रहे हो यार विश्वजीत, इतना डिफिकल्ट पेपर? कोई बात नहीं, हो जाएगा, हो जाएगा, इजी आएगा क्वेश्चन। एमटीडी एंड सेफ्टी इज गोइंग टू बी considerable into the phase 1 reaction, right? Now you have two documentation, that is your IND as well as the NDA, right? Hi, okay, वो तुम्हें हाई कर रहा है, तुम उसको हाई कर रही हो, दैट इज गुड, फाइन। हाय हाय चल रहा है, हाय हाय, तोबा तोबा, हाय हाय, है ना। IND, investigational new drug application, INDA to be precise. Okay, can anyone tell me INDA is going to be filed after which phase? Hmm? IND, investigational new drug application, INDA to be precise. Okay, can anyone tell me? Anybody? Chalo, INDA is filed after the preclinical trials, right? After the preclinical trials, INDA is filed, whereas NDA is filed after phase 3. After phase 3, okay? Generic medicines नहीं रे, अंबरी पुड़ी नहीं, preclinical is के बाद is INDA, new drug application is 3. Why it is being called as new drug? Because that new drug is going to be come under the market, right? You know that after third phase the drug will be marketed, right? After the third phase the drug will be marketed, so that's why NDA is filed after phase 3, right? And INDA, investigational new drug, investigation किस में करोगे? क्लिनिकल ह्यूमंस पे करोगे, तो दैट इज गॉन phase 1, phase 2, phase 3 एंड phase 4, ठीक है, ओके। एंड ANDA is for the generic, ANDA अंडा is for the generic अंबरीपुरी, 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 okay. चलो, this is going to be the thing and that is important, okay. Phase 1, healthy volunteers, healthy volunteers, okay. चलो, INDA से पहले, before INDA pre-clinicals, after NDA phase 3 clinical trials, and at the same time if you are preparing for the generic medicine, then apart from NDA you will be given ANDA at the same time to the regulatory authorities. What is the regulatory authority of India? Anybody? What is the regulatory authority of India? Shit, मैं गलत हो गया, मैं गलत हो गया, okay. चलो, regulatory authority of India, Okay, here you have the next question. Which of the following cognition enhancer is an NMDA antagonist? Okay, NMDA and ये इसको change करो यार. ये लेके आओ. हाँ. NMDA antagonist. CDSCO. Very good. Very good. Very good. Very good. No idea, Vishwajit. How? CDSCO, Central Drug Standard Control Organization, under the Ministry of Family and Health Welfare. Ministry of Family and Health Welfare. And this question was asked in GPAT. Ki CDSCO comes under which ministry? That's your Ministry of Family and Health Welfare. Simple. Donepezil? Na. Galantamine? Na. Rivastigmine? हाँ donepezil yeah है but the NMD antagonist we have na. So NMD antagonist is what? The memantine. Right? Apart from NMD antagonist, can we name some list? Dextromethorphan? There was yes, GPAT 2026 Ministry of Family and Welfare and Health Welfare. Family and Welfare. चलो जो भी है. Dextromethorphan, right? NMD antagonist. Ketamine, NMD antagonist. Amantadine, NMD antagonist, and here you have the memantine. These are all what? NMDA antagonist. You have to remember this one, okay? Chalo. Okay, can anyone tell me what is the drug of choice for Alzheimer's? Drug of choice for Alzheimer, guys? Huh? Drug of choice for Alzheimer's? Anybody? Anybody? Anyone? Drug of choice for Alzheimer's? No? Na, Ambadipudi. Tacrin was used as a drug of choice earlier. But since Tacrin has severe hepatotoxicity, was having severe hepatotoxicity, that's why it is now banned. Now donepezil is considered to be as the drug of choice for Alzheimer's. Okay, नहीं टैक्रीन नहीं है. टैक्रीन पहले थी अब नहीं है. चलो opioid antagonist agent is methadone, codeine, pethidine, naltrexone. चलो सिंपल है. Simple. Hmm. Opioid antagonist agent is methadone, codeine, pethidine, or naltrexone. Simple. Anyone? Methadone, codeine, pethidine, or naltrexone? That's your naltrexone, right? And naltrexone is also being used in, used in which kind of a thing? Used in morphine poisoning. Morphine poisoning, right? Morphine poisoning, and you can say that alcohol withdrawal symptoms. Alcohol withdrawal symptoms, maybe they have been used to reduce down the alcohol withdrawal symptoms. Naltrexone is being used over there. Okay, chalo. Which of the following antifungal drug is effective in treating kala azar? Chalo, simple hai. Kala azar, paromomycin, amphotericin B, morphine poisoning. Yes. That's right. Hana? Miltefosine and sodium stibogluconate. Chalo. Which one is it? Treatment in the effective in kala azar. Drug is effective in treating kala azar. Naloxone and naltrexone. That's right. Vishwajit. So that is amphotericin B. Very good. Liposomal. Amphotericin B is being used for the kala azar, right? Now, can anyone tell me what is the mechanism of action of amphotericin B? What is the mechanism of action of amphotericin B? Don't tell me it is an antifungal drug. It is written over there. But what is the exact mechanism of action of the amphotericin B? That's what I'm asking. Yep. Anyone? Anyone, guys? Cell membrane synthesis inhibitor. That's yes. That's yes. Leakage of cell membrane components. Very good, Ambadi Pudi. Yes, ergosterol synthesis inhibitor. Ergosterol synthesis inhibitor, right? It also increases the size of pores through which the 5-flucytosine enters, right? And amphotericin B plus 5-flucytosine have a synergistic effect. Which effect? Antifungal effect. 5-flucytosine, right? Can anyone tell me what is the mechanism of action of 5-flucytosine? 5-flucytosine? Anyone? Mechanism of action of 5-flucytosine? Yeah, that's what I'm asking. It inhibits the thiamidylate synthetase, right? Thiamidylate synthetase को inhibit कर देता है. That is your 5-flucytosine. Okay, चलो. First line, antiretroviral regimen for adults. Antiretroviral. Okay, retroviral means HIV, right? HIV. Okay. Tenofovir, lamivudine, efavirenz, lopinavir, darunavir, retinovir, etisatinavir, tenofovir, efavirenz, abacavir, lamivudine or stabudine. Chalo. Which one is it? Hmm. Anyone? Guess. Anyone? That's going to be right. Agar Lakansha, very good. That's your tenofovir, lamivudine, and efavirenz, right? Tenofovir is your anti-herpes drug, right? And lamivudine is your nucleoside reverse transcriptase inhibitor. Yeah. Or efavirenz is NNRTI, right? Chalo. Now, which of the following anti-cancer drug is only active triazine methylating agent and also a drug of choice for glioma and other brain tumors? Okay, now we have got the question right. Triazine, the carbazine, we are talking about the ईयर कट ऑफ अभी बच्चा बताता हूँ रुको. Dacarbazine, nitrosoureas, right? Nitrosoureas, nitrosin, carmustine, and lomustine. Carmustine as well as the lomustine. These are the examples of nitrosourea, but temozolomide is also a drug which is having good triple B permeability, permeability, and hence it can be used for the glioma and other brain tumors. Now, if I talk about, yeah, GPAT cutoff, तो यार देखो, अच्छा, insulin have got 255, under आराम से 200 के आसपास रैंक you can get, under 255 तो आराम से 200-300 के आसपास मिल जाएगा. You can expect 200-300 around. Any idea? I told you guys कि 180 के आसपास होना चाहिए जनरल का, and EWS तो around 150 to 160 maybe. OBC is around 140 to 160 maybe, right? And SC is around like 120 or something, and ST is obviously that's going to be your below 100 to 110. That is going to be the cutoff maybe. That's what I think. That's what I think. That's what I think. Okay. Chalo. Now, which of the following drug is not a first line anti-tubercular drug? Not a first line anti-tubercular. Simple. That's your Paris, if you remember. Hana, now tell me the answer. Now tell me the answer. Anyone? तुम्हारे कितने बन रहे हैं विश्वजीत मार्क्स? That is going to be your isoniazid, rifampicin, ethionamide, pyrazinamide. Ethionamide is going to be correct answer, right? Hmm. So ethionamide. And now if I talk about ethambutol, then under 1000, अंडर 1000, ऑब्वियसली 200 300 तो अंडर 1000 ही है ना. इंसुलिन. हाँ. What do you think? 200 and 300 is not under 1000. It's under 1000 itself, no? चलो ethambutol. Etham is a first line drug, right? And ethambutol is causing the visual side defects, right? Visual side effects. Eye toxicity. E for eye toxicity, right? This what asked in GPAT 2026, right? And this what asked in NIPER 2023 as well. Yeah. हाँ पर सर अंडर 500 या अंडर 1000, यार मुझे लग रहा है 500 के आसपास तो आ ही जाएगा आराम से इंसुलिन. ओके. अंडर 500 आ जाएगा. बस योर नियर रियल नेम इंसुलिन. असली आईडी से आओ. मेरे भोले भाले इंसुलिन. हाँ 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 विश्वजीत अभिषेक सर बनने की कोशिश कर रहे हो. चलो. विच ऑफ द फॉलोइंग इज अ सेफर ड्रग टू बी प्रिस्क्राइब इन डायबिटीज ड्यूरिंग प्रेगनेंसी? ओके. डायबिटीज ड्यूरिंग प्रेगनेंसी. मेटफॉर्मिन, सल्फोनिलयूरियाज, insulin or repaglinide is safer to be prescribed in diabetes during pregnancy? Which one is it? Yes, 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 yes. Abhishek Yadav है रियल नेम. असली आईडी से आओ. हाँ अम्बदीपुरी. यस दिस ऑल्सो ऑन देयर. सर 183 है विदाउट बोनस. हाँ हो जाएगा आराम से. जनरल कैटेगरी और विच कैटेगरी? चलो दिस वन. मेटफॉर्मिन इज व्हाट? एएमपीके एक्टिवेटर. एएमपीके एक्टिवेटर. मत चलाओ पीके. मत चलाओ पीके. राइट. मेटफॉर्मिन. मेरा नाम आ गया. वही आंसर है. दैट्स राइट. इंसुलिन है ना. तो तुम्हारे अंदर तो दो चेन है ना. दो चेन है ना तुम्हारे तो. ए चेन एंड बी चेन. राइट. एंड यू आर कंबाइंड ऑल्सो. राइट. एंड विच काइंड ऑफ इंसुलिन यू आर? प्रो इंसुलिन और इंसुलिन? 133 विदाउट बोनस. कैटेगरी बताओ विश्वजीत. ईडब्ल्यूएस हो जाना चाहिए. हो जाना चाहिए विश्वजीत. आकांक्षा कैटेगरी बताओ. सर देन हाउ मेनी मार्क्स दे विल गिव? आराम से होना चाहिए. आई मीन 2 से 3 क्वेश्चंस तो बनने चाहिए तुम्हारे एक्स्ट्रा. आराम से यू विल बी गेटिंग 2 to 3 मार्क्स. 2 to 3 क्वेश्चंस ऊपर तो ऑब्वियसली अराउंड 10 to 12 मार्क्स यू विल गेट. ओके. एएमपी के एक्टिवेटर. ओके. सल्फोनिलयूरियाज पोटेशियम चैनल ब्लॉकर. पोटेशियम चैनल ब्लॉकर. राइट. एटीपी सेंसिटिव पोटेशियम चैनल ब्लॉकर. रेपाग्लिनाइड सेम. मैग्नेटाइड्स. मैग्नेटाइड. Right. Metformin. Another was the fenformin. Another was the fenformin, and fenformin has lactic acidosis kind of a thing. Lactic acidosis, and that's why it is banned now. It is banned now. Right. चलो. इंसुलिन मेरा नाम ही आंसर है सही. सर हाउ मेनी मार्क्स दोगे? ओके. सर ये वाले इंसुलिन में दो चेन है. ये जीपैट चुराया है एक इसके मैम के. अच्छा. ओबीसी 133. अगर बोनस मिला तो यू हैव चांस, अदरवाइज थोड़ा सा मुश्किल है. यस सर 31B and 20. Insulin beta. If you don't remember, A chain has 21 and B chain has 30. You are telling the wrong thing. Maybe. You are telling the wrong thing. You saying 31B and 21A. No. 21A and 30B. That is the right thing. I'm rapid acting glulicin, and that is also asked. Rapid acting also asked. Right? Ambadi Puri saying no insulin. Yes, yes, insulin is wrong. Abhishek Yadav. Chalo. A chain has 20. A chain has 20 and B chain has, sorry, A chain has the 21. A chain has 21 and B chain has 30, and which both of these are combined with disulfide bonds, right? हो जाता है कभी कभी, डोंट वरी, हो जाता है. सॉरी आई एम लिटिल बिट कंफ्यूज. हो जाता है. एंड इंसुलिन की बात करें तो दैट इज आल्सो इंपॉर्टेंट, राइट? एंड इफ आई टॉक अबाउट, सी, ग्लूलिसिन, aspart and lispro, these are the short and rapid acting, right? And if I talk about long acting, then glargine, glargine and detemir. Glargine and detemir, these are the long acting drugs. Okay, this is important, guys, I'm telling you, right? And isophane, this is the isophane, as well as you can say lente, semi-lente, these are your intermediate acting. Okay, chalo. So glulicine, aspart and lispro. Hey, glulicine, aspart, if you have played that game, Asphalt Nitro, right? Asphalt car racing का game आता था पहले. Asphalt, तो aspart and lispro, that is short and rapid acting. Large, large means long, and determination, large determination, that is your long acting. Isophane and lente word will be always be coming into the intermediate action. Okay, I hope this is very much clear, and this is very much important as well, right? You can expect one question from here. Chalo. Which of the following CNS stimulant is an analeptic drug? Analeptic drug. Which one is an analeptic? What is analeptic, guys? What do you mean by analeptic? What do you mean by analeptic? So, yes, sir, अब याद आ गया. दगाबाज रे है, दगाबाज रे, है ना? इंसुलिन प्रजाति से होकर के भी इंसुलिन के अंदर का सिस्टम नहीं जानते हो. दगाबाज. अरे, गाल पर थप्पड़, गाल पर रैपिड थप्पड़ मारो, श्रीकांत सर का ट्रिक. अच्छा, ओके, ठीक है, नाइस. That is going to be, अरे, what are you saying, guys? B, no. Picrotoxin is not. Doxapram. Doxapram is the analeptic drugs. Analeptics are one which increases the respiration, which increases the respiration. These are analeptic. Ambadipudi. Anorectics are the one which decreases the appetite. Okay, anorectics are decreasing the appetite. All right. Respiration related to analeptics. Neuroleptics. Neuroleptics are what? Which are D2 depleter, D2 blockers. Doxapram is correct answer. Right? Sibutramine. Sibutramine. Amphetamine. Amphetamine. These are your what? These are your anorectic. ये hunger को कम कर देते हैं. They decrease the hunger. नहीं सर, इंसुलिन का अंदर पड़ा हूं, बस थोड़ा कंफ्यूजन. Yes, 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 yes. Acha, yesterday phentermine was asked. Yes, phentermine was asked yesterday. हाँ बेटा इंसुलिन, तुम भी पूछे थे, क्या बात है? हैं, तुम भी पहुंचे थे आरआरबी के लिए? चलो, ओके फाइन. Now you have next question. Following drug is used as an inhalational anesthetic. Okay, inhalational anesthetics. Diazepam. सुलेन थर्ड शिफ्ट में आया था. डाइजेपाम, मिडाजोलाम, एटोमिडेट और नाइट्रस ऑक्साइड. इनहेलेशनल एनेस्थेटिक, सिंपल. चलो, टेल मी. डाइजेपाम, मिडाजोलाम, एटोमिडेट और नाइट्रस ऑक्साइड. तुम देकर के आया था क्या इंसुलिन? आरआरबी का पेपर, आरआरबी का क्वेश्चन पेपर. आई मीन कल थर्ड शिफ्ट में. नाइट्रस ऑक्साइड. दैट्स योर करेक्ट आंसर. वेरी गुड. चलो. Now, which of the following benzodiazepines is sedative hypnotic? Shortest acting sedative hypnotics. Hmm. Florazepam, diazepam, temazepam. अच्छा, lorazepam. Very good. Very good. Very good. Very good. कहाँ गया था सेंटर? कहाँ गया था सेंटर तुम्हारा इंसुलिन? Which of the following benzodiazepine is short acting sedative hypnotics? Florazepam, diazepam, temazepam. This is your temazepam. Very good. Sure. A major inhibitory amino acid neurotransmitter in mammalian CNS is glucose, sodium, GABA or serotonin. बच्चा knows this one. बच्चा knows this one. चलो, this one simple. जीपैट प्रिपेयर करने के बाद फार्मासिस्ट पेपर इजी लग रहा था, बस नॉन फार्मा नहीं बना सर. नॉन फार्मा तो नहीं बनता है, मुश्किल ही आता है. गाबा इज योर मेजर न्यूरोट्रांसमीटर इनहिबिटरी अमीनो एसिड. What if I asked about glycine? And what if I ask about aspartate? What if I asked about the dopamine? कहाँ गया था सेंटर इंसुलिन? चलो. ग्लाइसिन इज व्हाट? इनिबिटरी एक्साइटेटरी. अस्पार्ट्रेट इनिबिटरी और एक्साइटेटरी. डोपामीन इनिबिटरी और एक्साइटेटरी. विच वन इज इट? टेल मी. सर नाइपर का नॉन फार्मा करवाएंगे. विल बी डूइंग, डोंट वरी. सर आई एम फ्रॉम यूपी बट लिविंग इन गुजरात. सूरत गया था मेरा सेट. ओके 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 ओके. मैंने भी दिया था वैसे कल. आरआरबी थर्ड शिफ्ट में भी गया था पेपर देने. चलो, ठीक है. ग्लाइसिन, aspartate and dopamine. Which one is it? Glycine is inhibitory as same like the GABA, right? Aspartate is excitatory, and dopamine is both. Dopamine is both, that you both inhibitory as well as the excitatory. Okay, so remember that one. Now, phenylephrine has, तो सर मतलब मेरी सीट गई. अरे नहीं यार, उतना भी आसान नहीं था पेपर फिलहाल. चलो ठीक है, डोंट वरी, उसके बारे में बात नहीं करेंगे. सीट नहीं गई भाई. सीट किसकी जाएगी भाई? सीट कहाँ जाएगी? अहमदाबाद जोन से बोला मैंने, इलाहाबाद से बोला था. चलो. फिनाइलेफ्रीन हैज अ, प्रयागराज बोला था मैंने. चलो. फिनाइलेफ्रीन हैज अ लेस ए एंड बी एक्टिविटी देन नॉरएपिनेफ्रीन. ओके. Metoprolol is selective beta 2 agonist. Norepinephrine is immediate precursor of dopamine. Dopamine has very good oral activity. Choose the most appropriate answer from the options given below. ठीक था पेपर. चलो. A and B only, C and D only, A B C और D only. चलो. Phenylephrine is what? Phenylephrine is what? Alpha 1 agonist, right? Phenylephrine is alpha 1 agonist, right? Metoprolol is selective beta 2 agonist. Yeah, that is also right. Norepinephrine is an immediate precursor of dopamine. नहीं, dopamine से norepinephrine बनता है. So that is wrong. Dopamine has very good oral activity. No. A and B is going to be right, right? मैंने प्रयागराज से भरा था. अहमदाबाद. Okay. चलो. Now, cocaine and procaine are benzoic acid derivatives, and both are known to cause the allergic reactions, right? Cocaine and procaine are benzoic acid derivatives, and both are known to cause the allergic reactions. Okay. Structurally, cocaine contains tropine nucleus, whereas procaine doesn't. Okay, in the light of the above statements, choose the most appropriate answer from the options given below. Which one should be correct? Which one should be correct? Hmm. A and B is right. A is right, Vishwajit. That's right. That's right. Chalo, this way. Isme. In this one. Both statement 1 and statement 2. Yes, that is going to be very much right. Yep. Chalo. Levorphenol and dextrorphan are stereoisomers of each other. Identify the true statement about 1 and 2. About 1 and 2. It is first is analgesic, whereas second is antitussive. Okay. First is anti-cancer, second is anti-malarial, antifungal, cardiovascular, neurotropic and antidepressant. क्या ही पागल बनती है. चलो. Anyone? Simple? Very simple. Just classification. Simple classification. Simple classification. Girlakansha says A. That is very much right. Right. Levorphenol is analgesics, whereas dextrorphan is your anti-tussive. Chalo. Very good. Now, what are the possible drug receptor interactions? Arene cation, hydrogen bonding, pi stacking, or all of the above. चलो भाई. पहली में ही आंसर है टेक्स्ट्रोफन. यस. यस. चलो. This one, Vishwajit. Very good. Hana, what are the possible drug receptor interactions? Arene cation, hydrogen bonding, pi stacking, all of the above. That is all of the above. Very good. Atropine is served as a prototype molecule for which of the... अरे भाई साहब, क्या ही question. चलो. First. Hmm. That's your anticholinergic, right? Atropine is going to be your anticholinergic drug. Chalo. Simple. Which of the following statement about drug metabolism? Correct about the drug metabolism. Okay. Phenobarbital and rifampicin are inducers of CYP 450. Cigarette smoke leads to the decrease in CYP. No. Cimetidine is the only H2 antagonist that induces the okay CYP 450. Okay. 17-ethyl estradiol is non-mechanism based inducers of the CYP 450. Which one is it? Which one is it, guys? Remember GPRS cell phone, phenobarbital, and rifampicin is going to be your CYP 450 inducers, right? And what is the effect of inducers? Inducers. First of all, there is a drug and there is a B drug. For example, this is an enzyme inducer, right? Enzyme inducer. So metabolism of drug B, metabolism is going to increased or decreased? Metabolism of drug B is going to increase or decrease? That's what I'm asking. Increase or decrease? Hmm. Metabolism of drug B is going to increase or decrease? Dose बढ़ाना पड़ेगा. That's right, and that's why metabolism increase हो जाएगा. तो dose we have to increase, right? चलो. Which of the following is incorrect statement? Incorrect statement. Dopamine can exist as a trans rotamer. मेटा बढ़ जाएगा इसलिए डोज बढ़ाना पड़ेगा. हाँ, मेटाबॉलिज्म बढ़ जाएगा. यस. Dopamine can exist as a trans rotamer, trans beta rotamer, cis A rotamer. Salicylic and resorgelin are selective irreversible inhibitors of MAO-B. Tolcapone and entacapone are reversible CUMT inhibitors. Serine is the precursor of dopamine biosynthesis. Chalo. Simple. Simple. Incorrect statement. This is right. Salicylic and resorgelin, MAO-B. That is right. Hana, MAO-A I told you. MAO-A I told you that is your moclobemide and chlorgyline, right? Moclobemide and chlorgyline. Non-selective MAO. These are your tip, right? TIP tip. That is your trenylsapramine isocarboxazide as well as the phenelzine, right? Tolcapone and entacapone are reversible CUMT. That's right. And if I talk about tolcapone, this is acting centrally as well as peripherally. Okay, this question has also been asked. This question has also been asked previously, that which of this UMT inhibitor is acting both sides, centrally as well as the peripherally. So here you can see two over there. Two means two sides, right? So centrally as well as the periphery, tolcapone. Serine is the precursor of dopamine and biosynthesis? No, that is not. So what is the precursor of dopamine synthesis? Can anyone tell me? What is the precursor of dopamine synthesis? Anyone? What is the precursor of dopamine synthesis? That's what I'm asking. So the functional catalytic unit of esteric site at the acetylcholinesterase is composed of HCHE, glutamate, histine, tryptophan, glutamate, tyrosine, lysine, glutamate, tyrosine, phenylalanine, or glutamate, histine, or serine. Which one is it? Phenylephrine, tyrosine, right? So phenylalanine, phenylalanine, and tyrosine. Okay. So this is going to be glutamate, histidine, as well as the serine is going to be the esteric site of acetylcholinesterase, right? Chalo. Now, can anyone tell me the ACHE reactivators, ACHE reactivators, which of the drug is known to be as the ACHE reactivator, guys? Anyone? ACHE reactivator? Huh? Anyone? ACHE reactivator, that's what I'm asking. No? Pralidoxim. Very good. Pralidoxim. Right? And pralidoxim is being used in your organophosphate poisoning, right? Organophosphate poisoning may it is being used with atropine, right? ACHE reactivators. Reactivator, I am asking, Akansha. Reactivator, I am asking. I'm not asking about the acetylcholinesterase inhibitor. I'm asking pralidoxin. Physostigmine is inhibitor. Okay. So now propantherine has been found to reduce the absorption rate of riboflavin, sulfamethoxazole, riboflavin and sulfamethoxazole, or none of the above. Chalo. Propantherine. Anyone? Propantherine has been found to reduce the absorption rate of riboflavin. Riboflavin is what? Vitamin B, thiamine, and the Ronaldo riboflavin, right? So vitamin B 2K cofactor, right? So that's your vitamin B2 cofactor, sulfamethoxazole. Sulfamethoxazole and trimethoprim. What is known as? Combinedly, they are known as sulfamethoxazole and trimethoprim. Combinedly, they are known as anyone? Skip over. Simple है यार. Riboflavin and sulfamethoxazole. Chalo, this one. Sulfamethoxazole and trimethoprim. Combinedly known as the cotrimoxazole. Cotrimoxazole. Right? And if you give into the ratio of 5 into 1, that is your dose. 5:1 is the dose. Once you give this in a dose of 5:1, you will get 20:1. 20:1 plasma concentration. Plasma concentration. That is important to remember. Right? Right? Trimethoprim acting onto the DHFRAs, dihydrofolate reductase. Dihydrofolate reductase. There's a sulfamethoxazole acting onto the dihydrofolate synthetase. Right? Synthetase, that's your sulfamethoxazole. So do remember. Sulfadoxin and trimethoprim. नहीं भाई, नहीं. Sulfamethoxazole होता है. Check your question again. Check your answer again. Okay, which of the following class of drug is not the OTC product? OTC product is what? The over the counter? Over the counter. Cough and cold remedies. Analgesics, antiseptic, antihypertensive drugs. Chalo, simple. Simple, simple, simple. That's your antihypertensive reactions, drugs, that is the ones. Okay. Chalo. Now this one. Given below are two statements. One is labeled as assertion, other is labeled as reason. Okay. So here you have cefuroxime. Cefuroxime acetyl is an oral form of the first generation parental cephalosporin cefuroxime. First generation. पहला ही गलत. The acetyl form of the drug is an acetoxy. Ethyl ester of cefuroxime has been increased lipid solubility, better absorption, and oral bioavailability. Okay, ठीक है. ये तो ठीक लग रहा है. Which one is correct? Which one is correct? Anyone? That is going to be DS. Very good. Hana? So it is written over here that cefuroxime is considered to be as the first generation. Now, can anyone tell me cefuroxime comes under which generation? That's right, D. That's right, D. But it comes under which generation? That's what I'm asking. Which generation of cephalosporin it is coming under? Yeah, anyone? Cefuroxime comes under the second generation. Okay, second generation. वैसे Me 110, this is coming under the third generation, right? This comes into the third generation, but cefuroxime is the only exception of Me which goes into the second generation. Okay, so that's right, Akansh. Very good. The hair follicle is usually present in which layer of skin? Epidermis, dermis, subcutaneous, or all of the above? Chalo. Hair follicle is usually present in which layer of skin? Epidermis, dermis, subcutaneous, or all of the above? Anyone? Hair follicle is usually present in which layer of skin? Epidermis, dermis. Jyotsna Patel. That is going to be B. Very good. Akansha, very good. B is going to be the correct answer. Now, Okay, blood group type and agglutinating. Okay, this question is important and you can expect this again in your CUET examination, right? O, A, B, and AB. So O has none, right? Nahin. Sorry, sorry. O has both anti-A and anti-B. A has anti-B, B has anti-A, AB has none, right? This is what the correct answer, right? So O is third. O is third, that is A, है So C is going to be the correct answer, right? Now, can anyone tell me which is known to be as the universal donor? Universal donor, guys. Universal donor. Anyone? Which is known to be as the universal donor? C is right. Very good. C is right. Which O? O positive or negative? O positive or O negative? Which one? गल्ला तेरी मिठिया सारी रात सुनदा जाऊं. Anyone? O negative. Yes, O negative. Right? And universal recipient? Universal recipient? Anyone? Universal recipient? Universal donor, universal recipient? Recipient then? Anybody have the answer to me of this question? Universal AB positive or negative? AB positive or negative? AB positive or negative? That's what I'm asking. Chalo, chalo, come on, fast. Hmm? Anyone? नहीं बच्चा नहीं रोचने कोहले no that is AB positive. AB positive is going to be the universal recipient. Okay. C donor O negative, right? Recipient AB positive. That you have to remember. Ulta negative ka opposite that is going to be positive with the recipient and negative you know how donor O negative. That's how. Okay. Chalo. Now this one. Okay, cars index. Cars index. Hmm. Flowability with compressibility index. Okay. Here you have this text now. Hmm. Chalo. Now this one. 110 is going to be the excellent, right? जब हम 1 से 10 साल के होते हैं तो हम बिल्कुल एक्सेलेंट होते हैं घर वालों की नजर में. धीरे धीरे हम जब बड़े होते हैं 11 से 15 साल की उम्र में आती है तब हमारा रंग फेयरनेस इंक्रीजेस, राइट? फेयरनेस, नॉट फेयरनेस, सॉरी, not fairness. That is going to be good, right? Excellent, good, and 16 to 12, yeah, 16 to 20, yeah. When you get kind of adult age, right? 18, then you get fair, and then you get fair, right? And after that, 27 to 32, but you have no money after that. No money after that. You become poor. That's your very poor. Simple. When I was first to 10th class, I was excellent in studies, right? 10वीं क्लास सबको अच्छी लगती है. 10वीं क्लास तक आई वॉज वेरी एक्सेलेंट इन माई स्टडी, राइट? 1 to 10. एंड देन 11 to 15 I was good, right? 16 to 20, at 18 years of age, my color, my facial expression goes fair, right? My facial skin going to be fair in direction. That's going to be fair, right? 27 to 30, no money. That's your very poor. So A is going to be your correct Answer. Right? Chalo. The parts of prescription called inscription contains name, age, signature, address, name and quantity of ingredient, registration number, and patient information. Chalo, simple. Anyone? Okay, so here you have name and quantity of ingredients in your inscription, right? And now if I talk about the subscription or signatura. What is the meaning of subscription and signatura, guys? Can anyone tell me? What is the meaning of subscription and signatura? Anyone? Sir, OBC 155 after bonus plus 20. अच्छा, 155 बोनस करने के बाद आ रहे हैं या पहले आ रहे हैं? That's what I'm asking. Vijay Media, pharmacist. Okay. Signatura subscription is your directions to pharmacist, right? Directions to pharmacist. And signatura is for directions to patient. Okay. Then you can have chance. Jyotsna Patel. Then you can have chance. Okay. Okay. Chalo. Very nice, Vijay. Chalo. The test performed to detect the presence of pyrogenic substances in parenteral products. Okay. Leak test, water attack test, lal test, or powder glass test. After bonus 175, that I can't assure you. But still you are in a good range. Okay, chalo. Leak test, water attack test, lal test. Limolus. What is the full form of lal? What is the full form of lal test? Limolus anti-levisite, maybe? Yeah? Okay, Limulus amoebocyte lysate. Yeah. Limulus amoebocyte lysate test. That is going to be the full form of lal test, right? Right? And water attack test is being considered to be on which kind of the glass? Which type of glass? Water attack test is performed onto which type of glass? Anyone's? Leak test are being considered for the ampules, right? Ampules. Water attack test? Anyone? Water attack test in your type 2. That's your treated soda lime. Treated soda lime, right? Water attack test. Treated soda lime. Okay? Chalo. Pyrogens are what? Products of metabolism or microorganism, a link between living or non-living, special type of bacteria, special type of virus. Simple. Simple, guys. Pyrogens are what? Products of metabolism of microorganism, a link between living and non-living, a special type of bacteria or special type of virus. Simple. These are what? Pyrogens are what? They increase the temperature of your body, right? They increases the temperature of body, right? Pyro means temperature, right? And gens means obviously the living ones. So product of the metabolism of microorganisms, specifically gram-negative bacteria. Gram-negative bacteria specifically, right? And they do produce the endotoxins. Endotoxins. toxins. Okay, chalo. Okay, apart from lal test, rabbit test are also there, na? Rabbit test, which is also known to be as the sham test, if you remember. Sham test, which is used for the pyrogenic test. Okay, chalo. Following antioxidant used to prevent the oxidative degradation of plastic. Okay, of plastic. Following antioxidant is used to prevent the oxidative degradation of plastics. Ultramarine, cresols, phthalate esters, or liquid paraffin. Which one is it? Which one is it, guys? Yeah, that's your cresols. Okay, cresols. Very good, Vijay. Very good. Cresols. Okay, class 100 is area. Array, array, array. Class 100, this was asked in your GPAT 2026. Yeah, they have asked like laminar airflow. Laminar airflow is installed in which area? Is installed in which area? That's what they have asked, right? So laminar airflow is acting onto the 100 area, right? Class 100 area, that is also known to be as the aseptic area, right? Abdul Ghaffar B, Gaurlakansha B, Vijay B, Vijay Yadav B. Very good. So we do have two Vijay over there. That's right. Okay, laminar airflow. So which of the following is not used as a tonicity contributor in sterile products? Okay. Tonicity contributor. Sodium chloride, yes they do. Glycerine, yes they do. Lactose, yes they do. Magnesium stearate. Magnesium stearate is something else. Okay, this is not the one. So magnesium stearate is the correct answer. Which of the following is not a component of continuous spray valves used in aerosols? Okay. Actuator, dip tube, low punch, stem or gasket. It's not gaskety. It's not gaskety, it's gasket. Chalo. Actuator, yeah, lubricant. Very good, Vijay. है ना? Actuator, dip tube, lower punch or stem gasket. It is not the part of the spray valve used in aerosol. Dip tube is made up of polypropylene, right? As well as the polyethylene, right? Dip tube. This is important. Okay, polypropylene, polyethylene made up of the dip tube, right? Stem gasket. These are Buna N, Buna N as well as Buna N or neoprene. Okay, this was the thing. Okay, chal. Which of the following material is not used as entry coating tablets? Material for tablets. Okay, not used. Okay, not used, guys. Not used. Cellulose acetate phthalate, Eudragit, polyhexyethylene, HPMC phthalate. Chalo. Which one is it? Simple. Buna N. Abdul Ghaffar. Very good. Very good. Buna N. Neoprene. Very good. That is your C, right? And if you see somewhere HPMC, or you see something of phthalate over there, right? Phthalates or HPMC, these are specifically used for the enteric coating, shellac, right? Shellac, as well as your Eudragit. These are all used for your enteric coating, whereas polyethylene glycols, no, PEGs are not. These are the co-solvents, right? These are what? These are your co-solvents, okay? Polyethylene glycols, okay? Chalo. Now, this is important. This is important. Newtonian fluids, pseudoplastic, plastic dilatant. Okay. Examples they are asking. Okay. Newtonian fluids, plastic flow, pseudoplastic flow, aqueous dispersions of the hydrochloride. Chalo, simple. High concentration of small defalcated particle. Defalcated and dilated. Yep. तो D का 1 होना चाहिए. तो D का 1 and Newtonian obviously going to be the water, so 2. right? The 2, 1, 2, 1. So that is going to be the correct answer. Plastic flow, concentrated suspensions, right? And C ka fourth, dispersion of hydrochlorides is going to be the correct answer, right? Deflocculated, always be considered that one deflocculated as your dilatant. Now, can anyone tell me which has the yield value? Which has the E value in the graph? Which of these flow has yield value? That's what I'm asking. Anyone? Yield value? Plastic. Very good. Very good. Very good. Okay. Pseudoplastic is also known as pseudoplastic is known as shear, and dilating is known as shear. What? Bingham bodies. Very good. Very good, Akansha. Bingham bodies. Now, pseudoplastic flow is also known as hmm, pseudoplastic flow is also known as shear, shear, thinning. Very good. Shear, thinning, and dilating flow is your shear thickening, right? And if I talk about, these are your time independent. These are your time independent, right? Whereas if I talk about time dependent. So time dependent is shear thinning. Shear thinning time dependent is your thixotropy, and shear thickening is your rheopexy. Rheopexy. Don't go towards the anti-thixotropy. Don't go towards the anti-thixotropy, because this is what sol, and then gel. Okay, this is not sol gel sol. No, rheopexy is sol gel sol, right? Theopexy is gel sol gel. Okay, but anti-thixotropy sol gel. That you have to remember. That you have to remember. Okay. If they ask about time dependent shear thinning system, then thixotropy. If they ask about time dependent shear thickening system, then rheopexy, right? Time independent shear thinning, pseudoplastic, shear thickening, dilatant. Okay. Now, can anyone tell me through which instrument we can determine the thixotropy? Through which instrument we can determine the thixotropy, guys? Thixotropy instrument? Anyone? Anyone, guys? Hmm? Thixotropy. That's what I'm asking. That's your planimeter, guys. That's your planimeter. Okay. Planimeter is going to be the uh, instrument which is responsible for to determination of the thixotropy. That's your planimeter. Okay. That is important. Sure. The velocity of sedimentation of a uniform collection of spherical particle of suspension is governed by Stokes' law. The rate of sedimentation as per Stokes' law is inverse the function of. Okay. Stokes' law. Stokes' law. Stokes' law. Inversely proportional. Inversely proportional. What I know is eta is into the denominator side. Eta, and eta is what? Eta is what? Viscosity, right? Eta is what? It is not viscometer. Viscometer is used to check the viscosity. But if I talk about particularly thixotropy, then planimeter. Planimeter, that is important, and that is already asked in your GPAT examination. But GPAT is over now, but still CUET PG is still left. Okay, that is going to be viscometer, right? D square and surface area, maybe something like that. There is a equation of there. So that is viscosity. Okay, chalo. Which of the following material can be used as glidant, lubricant as well as the anti-adherent? Chalo. Lactose, starch, magnesium stearates, polyethylene glycol. Which one is it? Which one is it? Which one is it, guys? Yeah, that is magnesium stearate. Okay, magnesium stearate. अरे आजा भाई मेरे. Yes, magnesium stearate is going to be the correct one. Bancroft rule is related to the determination of. चलो ये तो simple है. Bancroft rule. Bancroft rule is related to the determination of suspension rule type, emulsion type, ointment type, or tablet type. Simple. Suspension, emulsion, ointment, or tablet. Bancroft rule. So that is what emulsion type. Very good. Very good. Very good. So Avicel is a trade name of Avicel. चलो ये भी simple है. That is simple. Avicel. Polyvinyl pyrrolidine. Polyvinyl pyrrolidine is your what? That's your super disintegrant. Scap is your polymeric polymer for enteric coating, right? Microcrystalline cellulose, yes, that is what the Avicel is, right? Lactose has Maillard reaction, if you remember. Lactose has a Maillard reaction when it is combined with isoniazid, right? To be the primary amine, right? Primary amine, and that forms a furfural compound. That forms a furfural compound. That is what the Maillard reaction is, if you remember. And a Maillard reaction is important. Okay, chalo, lactose. Okay, particle size analysis. Following are used for the particle size analysis. Coulter counter, particle size, हाँ ठीक है. Microscopic, ठीक है. Sieving, ठीक है. IR spectroscopy. Beginner cooking. अच्छा cooking करते हैं आप. 159 without bonus OBC. Yes. Good direction on a good side, but still there is a 70-30 chance that I can say. 70 you qualify, 30 you may not. That's what I can say. So that is going to be ABC, right? IR spectroscopy are responsible for determining the what? Functional group, right? Functional group, if you remember. Hana? Functional group. Are you guys here or not? Are you guys here or not? Only three people are here. See the difference. Am I teaching bad? Am I teaching bad? Hmm? Tell me, am I teaching bad, you guys? Hmm? Am I doing something wrong? Then why there is only three people over here? Hmm? Why? Why? Why only this much? Sir, it seems to be that I'm teaching wrong or I'm teaching bad. Fine. Chal. Okay, partition coefficient. Partition coefficient of various drugs can be determined using reverse phase evaporation, shake flask method, coacervation phase separation, technique of wet granulation. Reverse phase evaporation, nahi. Shake flask, yes, that's right. है ना? Log P value, shake flask method, right? So tell me one thing, that if the log P value increased, then is it hydrophilic in nature? Is it hydrophilic in nature or lipophilic in nature? If increased lipophilic, if increased log P value is there, right? Which one is it? Shake flask method is your correct answer. Yeah, you're doing good, Macha. Thank you, Macha. Thank you. Thank you. Vijay Media. You seems to be from Tamil Nadu, right? Vijay, you seems to be from Tamil Nadu. From Chennai base. Chennai. Acha, Vijay, you are from Crash Course, maybe. No, Rankers batch. I don't know exactly. Rankers or uh, Rankers or Crash? Food time, sir. I have sacrificed my food for you guys. Chalo, no worries, no worries. So log P value if increased, so hydrophilicity will be increased, right? If P value decreased, then lipophilicity increased, right? Chalo, shake flask method. Rancor, yeah? Chalo. Noe-Whitney equation is used to describe what? Absorption, metabolism, dissolution, distribution. Which one is it? Simple? Simple. Absorption, metabolism, dissolution, or distribution. That's obviously going to be your dissolution. Bacha knows about that one, right? Noe Whitney. Considering apothecary system, 300 minims of the fluid is equal to 1 pint, 1 5 fluid drachms, 1 fluid ounce, or 1 gallon. डॉक्टर सृष्टि नहीं क्या लिखा है दृष्टि अच्छा दृष्टि रावत ओके मैंने को लगा डॉक्टर है कोई सृष्टि रावत ओके रावत फ्रॉम हिमाचल उत्तराखंड चमोली someone from there maybe you are from there no okay 5 fluid drachms now which of the following is the amount of 20% of weight by volume ointment required to be added to a suitable diluent ointment to prepare 5 kg of 2.5 weight by weight benzocaine ointment okay kitna which of the following is the amount of 20% of weight by weight benzocaine ointment required to be added to a suitable diluent ointment to prepare 5 kg of itna x into 20 is equals to 5 into 2.5. Is it that so? No, that is not going to happen. Let it be. That's your 625 grams, okay? Chalo, now this one is important. This one is important. IgG, IgE, IgM, IgD. Okay. IgG, IgE, IgM, or IgD. IgG largely confined onto the internal body fluid. Okay. Internal body. आजा यार. Internal body fluid. Then IgE is going to happen with the serum. Yes. And IgM Uttarakhand, right? सृष्टि रावत समझ गया था मैं उत्तराखंड से. Okay. IgM is going to be happen with largely confined to bloodstream, and IgD is going to be serum on lymphocyte surface of newborn babies. So C is going to be the correct answer, right? C is going to be the correct one. Now, which of the following statements were not true about endotoxins? Uttarakhand में कहाँ से? सृष्टि रावत, दृष्टि रावत, sorry. Okay. Endotoxins cannot form toxoids. Endotoxins are released from cell walls of lysed gram-negative bacteria. Endotoxin are proteinaceous by chemical nature. Endotoxins are heat stable. Which one is it? Match the following statement is not true about endotoxin. Cannot form toxoids. Endotoxin are released cell walls, gram-negative bacteria. That's right. Endotoxin are proteinaceous by chemical nature. Proteinaceous. It's not proteinaceous. It's polysaccharides. These are polysaccharides. Okay, just like the lipopolysaccharides, LPS, and onto which I have done my masters. मेरा research project LPS पे ही था ना, lipopolysaccharide. These are your endotoxin lipopolysaccharides होते हैं, polysaccharides. Okay, चलो. Which technique is not used for preservation of food? Not used for preservation of food. Canning, tanning, pasteurization, or sterilization. Not used for the preservation of food. चलो. Canning, tanning, pasteurization और sterilization. उत्तराखंड में कहाँ से दृष्टि रावत? सड़पती हूँ. Anyone? Yeah. Canning, tanning, pasteurization, sterilization. Yeah, that is used to for production. Yeah, that's for use for the preservation. Pasteurization, obviously, right? Garhwal. Okay. कुमाऊं एंड गढ़वाल रीजन. कुमाऊं से नहीं हो, गढ़वाल से हो. पिथौरागढ़. नहीं, पिथौरागढ़ तो कुमाऊं रीजन में आता है. गढ़वाल पता नहीं, मुझे याद नहीं है. चलो. Canning and tanning, that's your tanning, guys. Okay, tanning is going to be the correct answer. चलो. Microorganism involved in the production of sausage food product. Sausage food product. Okay. Lactobacillus lactis, Enterobacter cloci, Pediococcus crevice, Lactobacillus thermophilus. Which one is it? Which one is it, guys? Which one is it? That's your Pediococcus crevice. Okay. So all bacteriophage have nucleic. So teaching is your mainly main job or private time? Why are you asking this one? Why are you asking this one? What made you think to ask, Vijay Media? So all bacteriophage have nucleic acid core covered by protein coat known as capsid, enveloped, filament, or flagella. Hmm. Which one is it? That's your capsid, right? Capsules are the ones which are having the coated by the protein coat, right? That is your capsid. Okay. Collection of all RNA transcribed elements for a given genome is known as. Chalo. Collection of all RNA transcribed elements for a given genome is known as transcriptomics, proteomics, metabolomics, or metabolomics. Because most of the students after M.Pharm they go industry. नहीं 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 ऐसा नहीं है. No, it's not like that. It's not like that. Ki most of the students they go industry. No, either they go for PhD, either they uh, go into the corporate side, either they go for the data analytics. They're not something like they should have also going towards the industry only. No, no. That's your transcriptomics, guys. Okay, transcription, transcribed elements. मैं फिर से तुम्हें डॉक्टर सृष्टि कह रहा हूँ. दृष्टि नाम है तुम्हारा. Okay. Now, which of the following is not as the adjuvant for preparation of vaccines? Aluminium salts, lipid A, glucose, or muramyl peptide. Not used as an adjuvant. I'm teaching only. I'm teaching only. I'm not going for PhD. I'm not going for anything right now. Right now, for timing, I'm not going for PhD. I'm doing this job only. Chalo. Aluminium salts, lipid A, glucose, or muramyl peptides. Which one? That's your glucose, guys. Okay. Chalo. Okay. Now, chemistry. Six-membered oxygen containing compound. Oxygen containing compound. Five-member nitrogen compound. Okay, six-member nitrogen containing xanthine nucleus. चलो भाई, xanthine nucleus that is तो caffeine for sure. तो D का 4, D का 4. Six-membered oxygen compound. Six-membered oxygen compound तो furan pyran. Yeah, that is going to be the one. So A का 1 and D का 4. तो A का 1. Yeah, that is going to be the correct answer, right? That is also going to be the correct answer. Yeah. 5-member nitrogen compound, 5-membered nitrogen containing. This is going to be the triazole, and 6-membered is your pyrimidine, right? Chalo. Now this one. Okay, these are the reagents. This is important, guys. Okay, this is important. This is important. Grignard reagent, Gilman reagent, benzyme mechanism, aldol condensation. Okay, aldol condensation, you have to remember the alpha hydrogens, right? So aldol concentration CH3CHO, yes, alpha hydrogen you got over here, two molecules. Aldol concentration, the D ka 3, D ka 3, D ka 3. Grignard reagent RMGX 2, right? Gilman reagent benzyme mechanism. Gilman is R2CuLi. So here you go. The correct answer is your B, right? Girl Krishna, B is your correct. Balakansha, sorry, girl Akansha. Okay, so sorry. Now identify the correct statement. भाई तुम लोग यार अपने सही नाम से आते ही नहीं हो, मुझे ऐसा लगता है कभी कभी, है ना? गिरी आकांक्षा या गर्ल आकांक्षा? अच्छा, गिरी आकांक्षा, ओके। कहाँ गिरी आकांक्षा? कहाँ गिरी आकांक्षा? Giri should be your surname, right? चलो ठीक है. So sorry. Now identify the correct statement with regard to acidity and basicity of the substances. Acidity and basicity of the substances, right? So this is what an acid is: a species having a tendency to accept a proton. Nah. A base is a species have a tendency to lose a proton. Nah. pH is the negative logarithm of the H3O concentration. Yes. Stronger the acids, the stronger the conjugate base. Nah. Okay, so pH is the negative logarithm of the H3O positive concentration. That is going to be the correct answer, right? So now hydrolysis of secondary butyl acetate yield secondary butanol with some rotation but with opposite sign. SN2 reaction gives the inversion of configuration at carbon under attack. That is right. Okay. Which one should be the correct? Which one should be the correct answer? Inversion takes place. Hydrolysis of secondary butyl acetate yields secondary butanol, right? Some rotation with opposite sign. Opposite sign हो गया तो inversion takes place, right? SN2 reaction goes with inversion of configuration of carbon atom under attack. Yeah, so that is A, and A is going to be the correct answer, and R explain the correct explanation of A. Simple. Chalo. Most stable conformation of acetylcholine. Chalo, tell me. Tell me which one is the most stable conformation of acetylcholine, guys? Anyone? Hmm? Most stable conformation of acetylcholine. Anyone? Huh? A. Yeah, that's right. A is your correct answer. Very good, very good, very good. Identify the false statement. Hard electrophile have a formal positive charge at the electrophilic center. That's your carbocations. Okay. The softest biological nucleophile sites are cysteine, thiol groups on protein. Primary and secondary amino groups of lysine and histidine on the proteins are hard nucleophiles. Softest nucleophile are the oxygen atoms of purines and pyrimidines on DNA and RNA. Which one? False statement I'm asking. I'm not asking about the true statement, Akansha. That's your B, okay? So glutathione GSH conjugation takes place by electrophilic attack by GSH on nucleophilic carbon of drugs, nucleophilic attack by GSH on electrophilic carbon of drugs, photochemical reaction of GSH with the drug molecule, ionic reaction of GSH with the drug molecule. Chalo. Glutathione conjugation. And glutathione conjugation is responsible for the paracetamol. Paracetamol. Mol, right? Paracetamol, metabolism, right? If you remember. Hmm? Which one is it? Anyone? That's your B, okay? Chalo. Electrophile addition to an unsymmetrical alkene is given by. अरे ये तो बहुत simple है. That is very simple. Sadzev rule, Markovnikov, Blank's rule, or CIP rules. Which one is it? चलो simple, simple. Come on. Markovnikov rule, obviously, na? Unsymmetrical CH3. Oh, sorry. हाँ कर सकते हैं. CH3 CH double bond CH2. That is what, है ना? And here you have the HBr, right? HBr. Then what is going to happen? Then what is going to happen? That is also given by the Markovnikov rule, right? Chalo. Now, for a chemical reaction to occur, it is necessary for the molecules involved to possess a certain minimum amount of energy. That's right. Activation energy can be thought of the energy barrier to be a reaction. That is also right. Right? Both of the things are right. So, that is right. Hana? Chalo, simple. Catecholamine are synthesized from? Chalo, simple hai. Very simple. Catecholamine are synthesized from lysine, glycine, tryptophan or phenylalanine. Anyone? Catecholamines are synthesized from the amino acids. Anyone? Nobody can confirm that, Vijay. Nobody can confirm that. It's not C. Giryakansha. It's D. Phenylalanine. Nobody going to confirm that one. Yeah, we can only predict ki ha itna you can get, right? But nobody can predict exactly, right? So hope for the best and we shall see that in your results, right? Generally, a steroidal ring contains ring A, ring B, ring A, ring B, C, D. क्या है भाई? हाँ अच्छा, how many rings are present over there? Okay. How many rings are present over there in steroidal skeleton contains? Yeah? Anyone? That's your four rings are present, right? A, B, C, D, right? Chalo. Supercritical fluid chromatography utilizes the supercritical fluid as a mobile phase. Okay, carbon monoxide, carbon dioxide, sulfur dioxide, or nitric oxide. Chalo, which one is it? Supercritical fluid chromatography. Supercritical fluid chromatography. This question is asked already in your examination. See, CVT PG 2023. Chalo, come on. Simple. That is too easy, right? This is what? Carbon dioxide, no? Carbon dioxide. Non-aqueous titration is suitable for the titration of very weak acid and bases and provides a solvent in which organic compounds are soluble. Acetic acid is most commonly used in the procedure of non-aqueous titration of organic shows bases with perchloric acid. Okay. So which statements are correct? Very weak acid bases. That's right. Okay. Acetic acid is most commonly used in the procedure of non-aqueous. Weak acid ही तो है acetic acid, right? An organic base, that's a perchloric acid. That is also a weak base, right? Sorry, weak acid, organic bases. So obviously that's going to be A, right? Both statement A and statement B is very much right. है Chromatographic technique are used for the separation of mixture of chemical compounds. Okay. D. Srishti, Drishti. No, it's A only. Chalo. Gas chromatography can be used for the chemical compound which decompose at high temperature. Menthol can be determined using UV spectroscopy. Nah. IR functional group. Yeah, that's incorrect. Okay, okay, incorrect. They have asked. Okay, incorrect. Okay, D is right. Proton NMR is arrangement of hydrogen in chemical compound. That is also right. है ना? Chromatography used for the separation of mixture of the chemical compound. Gas chromatography can be used for the chemical compounds. So A, C, and D are the incorrect statements. Who said C and D? D कैसे गलत हो सकता है? How infrared spectroscopy is determined to, that is how it is wrong? D, that is not right. Chalo. Cognosy now. Cognosy. Stomatal number is not sufficient. For the determination of leaf constant, only calculating stomatal number is not sufficient. Stomatal index should be also calculated. Okay. The number of stomata in a young leaf and matured leaves are the same. Which one is correct? Which one is correct, guys? Yeah, that's your both A and R is correct, and R is the correct explanation of A. Simple. Vincristine and reserpine are indole alkaloid? Proven. Indole alkaloid? Proven. Right? So, okay. Reserpine. हाँ ठीक है Rolfia. Reserpine. Okay. Vincristine, Vin alkaloids. ठीक है. Correct. Tyrosine and phenylalanine are the precursor of the synthesis of alkaloids. No, this is not right. है ना? Tryptophan are the precursor for the synthesis of alkaloids, so this is not right. A is correct, but R is not correct, right? Simple. R is not correct because tryptophan is responsible as a precursor for the synthesis of indole alkaloids, right? Okay. Tyrosine may quinoline. It is a precursor for quinoline. Okay. Phenylalanine, that's your tropane alkaloids. Tropane alkaloids. Okay. Chal. Okay. Lieberman-Burkhardt test is positive for digitalis, Dioscorea, and Strophanthus. Chalo. Simple. This is simple, guys. Chalo, come on. Give me the answer of this one. Give me the answer of this one. Chalo, this one. This one is easy. Hmm. This one is easy. Lieberman-Burkhardt test is positive for digitalis, Dioscorea, and Strophanthus. Fine. Chalo. Senna, cinchona, turmeric, or rhubarb. Senna is your sennoside, right? Cinchona, quinine alkaloid, turmeric, curcuminoids, and rhubarb is your chrysoferol, right? So one ka two, and here you have the two options. Then B ka one, right? Quinine. So this C is going to be the correct answer. C is going to be the correct answer. Simple. Chalo, this one. Atropine, arabesine, ephedrine, or strychnine. Okay. Atropine is what? Propane alkaloid, right? Propane alkaloids are told you that's your ornithine derived alkaloids, right? Ornithine. Anna? Okay. Strychnine. Strychnine is what? The Nux vomica. Anna? Nux vomica. And Nux vomica, you know, that's a proven to N for tryptophan. Tryptophan. So strychnine is your tryptophan. So 3 and 4. 3 and 4. Right? So A is, sorry. A is 3. A is 3 and D is 4. A is 3 and D is 4. So A is going to be the correct answer, right? Simple. Chalo. Now, gold beater test is performed for the determination of the presence of true tannins in a crude drug. ठीक है? Clove and coffee contains pseudotannins. In the light of the above statement, choose the most appropriate answer from the options given below. Chalo, simple. Which one is it? Hmm. Right? Anyone? Anyone, guys? अरे यार guess तो कर लो कम से कम. Even you can guess. That's your B, obviously. Both statements are correct, but R is not the correct explanation. Why? Because here we are talking about the pseudotannins, and here it was the true tannins. So these have no correlation with each other, but the statements are very much correct. Okay. Chalo. Artemisinin is an antimalarial drug, and chemically it is what? Sesquiterpenes, lactone, benzyl isoquinoline alkaloid, steroidal alkaloid, or endoquinoline alkaloid. Simple. That is simple. Very simple. Right? Chalo. If you won't be able to answer this one, then I don't know what's going to happen with you guys. It's that damn simple. Come on. Artemisinin have the lactone groups only. Lactone groups only. Cardinaloids and bufadienolides are cardiac glycosides. They're chemically different by the respective. Cardinaloids are 6 or 7, 5 or 6. Yes, obviously that's going to be happen. Cardinaloids are your 5 and bufadienolides, these are your 6 membered ring. In steroidal aglycone portion of the cardiac glycoside, what's going to happen? What's going to happen? That's your rings A, B, C, D are cis fused, whereas rings B, C have a trans configuration. Rings A, B, C, D are transfused, whereas B, C and have a cis configuration. Rings A, B, B, C, and C, D are the transfused, or rings A, B, B, C, and C, D are the cis fused. Which one is it? That's your A only. Rings AB and CD are the cis fuse, whereas the rings BC have a trans configuration. Alright, this is all about the CUET PG 2023 question paper explanation, guys. And this is all for today. And we'll be live again tomorrow at 10 a.m. 10 a.m. for 2024 question paper of CUET PG tomorrow at 10 a.m. Thank you so much, guys, and thank you so much for joining. All the very best. Do take care of yourself.